am very glad to be here and to talk about exercise in pediatric cancer patients from a palliative and ethical perspective. And to start with, I would like to try again the Mentimeter that you have already experienced yesterday. And therefore, I would ask you to grab your mobile phones and please scan this little barcode. And so we will see the answers to the question, when do you define a child as palliative, popping up while we wait a few seconds that everyone can participate. Tell me if it works, because sometimes I need to activate it. Yes, okay. We'll have some more seconds. End of life, palliative, life-limiting disease from diagnosis. Again, end of life, always if needed. I'm reading out a few of them out with you. Current curative approach not possible. No curative treatment. Relieving symptoms. Okay, thank you very much. Yeah, so thank you very much for participating. And as expected, some of you or some of the responses reflected very well the societal perception of palliative care. So many still associate palliative with end-of-life care or no cure, so which can lead then to a very late or delayed involvement of the palliative care specialist or even the care itself. Of course, palliative care includes end-of-life considerations, but fundamentally, I think we can agree that it is mainly about quality of life and symptom management. So we know that we can maybe say that it is providing, or it aims to provide a total care, and somehow it takes a holistic approach to do that, addressing the physical, emotional, but also spiritual needs that a child and the family has. Researchers have tried in the last for the last centuries to measure quality of life in pediatric cancer patients and survivors, but one foundational model was proposed by Farrell in 1991, highlighting again this 4 key components: so physical well-being, psychological well-being, social well-being, and the spiritual well-being. And if we ask then the children themselves how they perceive quality of life, of course, in different age appropriate questions, and you look in the data that we have through a lot of publication on the thematic, they are very, very clear in pointing out that quality of life for them is being at home, being pain-free, feeling loved, having activities, and having a sense of purpose and being a kid. And ethics is a vast and complex field with many branches in philosophy, and medical ethics specifically deals with moral questions in medical practice. It often demands even higher standards than the law, as it focuses on the motivation behind behavior rather than just compliance. And morality, on the other hand, is an individual internal compass, we could say. So it's shaped and influenced by culture, religion, education, experience, and it's related also to the historical context in which we are. So we could say that while ethics is reflective and systematic, morality is intuitive and deeply personal. Indeed, morals start, or we can learn morals very early on. Kids already share usually the moral of their family. They learn very early on, this is good, this is bad, don't do this because we don't do this, and so on. So it starts very early on, and then when reflection comes in the cognition and development of the child, there's different levels of this developing. And so before we continue, let me ask you one more question. And why do you think we need medical ethics for? So I would need your help here again. So we had a few definitions on ethics and morality, protection of patients. Guidelines. Ensure standard of care, protect individuals, continue learning, cooperation probably. Okay, have the best take care. Thank you. Thank you again. So that's it's a very tricky question, as it's quite, there are many reasons why ethical is essential in medicine, and we will be able to highlight only some of these key areas. Some of this you've already pointed out very well. So the first is pretty obvious. So the progress of modern medicine itself brought many benefits, but with the benefits, it brings also many challenges. So we can treat many diseases that would have been fatal in the past. We're focusing on prevention and supportive care, like we're all doing here. And but the questions that might come are like, where do we draw the line between, for example, life-saving treatments and over-treatment? And so these are not medical, but also, or not only medical, but also ethical questions that we have to address in the medical context. And then, of course, the paradigm shift from a paternalistic to a patient-centered approach to medicine that we all want, in which we demand the participation of those affected, so the patient, raises questions such as in the extent to which individual medical competence is sufficient to make the right decision in the event of illness. As we all know, and some of us might experience in the event of illness, there is the autonomy is per se quite might be quite limited. And as we all work in the pediatric field, we know that there is also the age-related and cognition-related challenges in this aspect. So we would like to give autonomy, but there are also a lot of challenges in doing this in the right way. And expecting competence from the patient is also quite tricky. In addition, we live in a pluralistic society, and so we also have to ask ourselves questions in the medical context, such as to communicate and respect different cultural values in medical decision-making. And then we have to ask ourselves, how does culturally sensitive communication work? Finally, there is the issue of resource scarcity that I'm sure many of you already experience in the different fields we all work in. And it affects, therefore, many areas in medicine. The biggest problem is maybe in the transplantation or the field of transplantation, as there is per se the resource, meaning the organs, as a scarcity problem there. But we experienced the resource scarcity and then the different ethical challenges in this also in the COVID pandemics, in which we have been asking how to ensure fair triage. And as we remember, many countries that are represented here today, we had all different and mainly medical and ethical approach to how to, for example, do patient selection in this quite challenging situations. So how do we strike a balance here? That's the main question. So, and as you know, there are many philosophical theories, there are many principles. So we'll definitely not be able to analyze or talk about all of them today. And we will only point out some aspects that might be helpful in this, in navigating these challenges. And I think we can agree that we can rely on core ethical principles that help us balance in medical care, but also on a daily basic challenging situations or with ethical responsibility. And these are represented by autonomy, beneficence, non-maleficence, and justice or fairness. And we already given by the fact that in a medical context, we have healthcare professionals, we have the patients, and we have their relatives, especially in pediatrics, it is obvious that this ethical principle will probably not be always in balance. So we have to find the optimal balance in here. If we consider the growing body of research you have already contributed to, and some of you might even be part of these publications here, you see in this research on exercise and pediatric oncology already ethical principles in balance, especially the one we've been already mentioned. So we can say that exercise intervention align with autonomy as we try to allow children to participate in decisions. It ensures beneficence or is based on beneficence, promoting physical and psychological well-being. And of course, justice, as it should ensure fair access to supportive care. And we want to improve this aspect, of course. Then we have also research ethics, which is obviously not just this four points that I pointed out here, but it also there's many further principles to be respected. But in clinical trials, we are looking for a fair subject selection. We are looking for the informed consent, and in this, in pediatrics, we might have the challenge of the age-related competence. And the balance between risk and benefit ratio, which we have been also analyzing in FORTEe, is to be in a good balance in order to ensure and provide meaningful benefits without undue burden. And as you know, we analyzed many of these aspects in VP2, and also VP2 survey has been, thank you to everyone that participated in the survey, has the goal to analyze the perspective of the healthcare professional in these ethical aspects and to see if we met them. And then, of course, the independent review process is important to uphold ethical standards. So my goal today was to offer an ethical and palliative care perspective on exercise, and I'm preparing myself. I could see that already the research that many of you have done, and obviously this trial is working with in a good balance with this. Ethical principles, as I already mentioned, we see physical benefits, and physical benefits can or are influencing the psychological benefit of the children, and therefore we are empowering the children in their autonomy. So we could say that all this, so ethics, palliative care, exercise therapy, supports quality of life, allowing ethical values and palliative care principles. And finally, let me share some preliminary results from the VP2 survey. We have been looking for many themes, and as I mentioned before, one of the most important in research as the ethics is also to see if there is a good balance in burden and benefit. And here you have some bubbles, and with things that some of you highlighted. So the experience was meaningful without overwhelming the patient. This is really important. And one very new and very important aspect is the adaptability of the study, which is very promising, especially to implement maybe this exercise program further on, and even make it possible for patients like palliative patients that might have even more physical limits, and therefore the adaptability, the possibility to adapt it to different stages, and the patient themselves is very promising. And all this underscores indeed the need for more ethical and flexible, as this adaptability shows, and patient-centered exercise program on pediatric palliative care. I'm very happy you're all doing this work, and hope this is going on and you keep on doing what you're doing. Thank you.